A mother goes to her first antenatal visit to have her baby seen, not to have an HIV test. So her reaction is often, "No, I cannot take the ARVs. I'm not ready. I must speak to my husband first."
In terms of dropping out, young women, teenage mothers were particularly at risk. Women that came to book very late in the third trimester, and then women that are finding out their HIV status for the first time during that first antenatal visit.
I cried when I tested positive at antenatal. I went out of the clinic and I started shouting at my husband. I could not believe it. It took several months before I could accept the result. I told the nurses that I could not disclose to my husband, so they helped me. They came to my house pretending that I hadn't been tested yet and asked permission from my husband to test me. They told him to get tested at the same time. We were both positive. Disclosure is the most important thing for someone to freely take the medicines.
The main reasons my clients drop out of treatment, it was fearing of getting divorced.
We had some clients who were told not to take the ARVs by the prophet of their church.
One was like, I have to be taking medication each and every day of my life. So it was like a burden to her.
I think women face issues in PMTCT when it comes to receiving services from the health personnel. If you work in the health setting, you discover that some health personnel, some health providers, they act to these women the way the women feel very bad.
Fear of divorce was the most common reason.
Mostly, the women lacked partner support. So for the sake of preserving their marriages, these women stopped accessing treatment. For some of them, their drugs were thrown away in the toilet. For the others, their spouses said, you don't need to go to the facility to get the medication or else you'll be divorced.
When my wife got tested, I was very disappointed. Our marriage nearly broke up, but I took advice from Patricia. The trouble in Malawi is that men think they're superior. If a wife tests HIV positive, then it is the wife's fault. To change this, we need men to talk to men.